Hi everyone, it's Nigel Giam here, the lead training program director for the St Mary's scheme and course director for MentorMRCGP. I'm so happy this afternoon to have Nalin come to talk to us about his game changes for the RCA. Nalin, you've got a very interesting story. You're very experienced previously as a GM consultant, is that correct?
Yeah, thank you very much for giving me the time. Yeah, so I worked 4 years in UCL London as a GM consultant before changing into the GP training.
Fantastic. What made you want to change firstly?
Actually two things. So one is I didn't like the how NHS is kind of going forward with the management structure and stuff. Yeah. Secondly, I thought GP would have more options going forward, and I had a salary sacrifice regime. That means I got the same salary. So I thought, why not additional
Okay, that's good. These are two really good reasons, but obviously we hit a barrier, didn't we, with the RCA? And I suppose, you know, the MRCGP is definitely not the MRCP. So I know that you had some difficulty attaining the exam. I'm so happy you have managed to now get the RCA. What do you think were the game changers between your previous RCA submissions and this most successful one? What did you do differently?
So basically, I think the main thing I got from, I think the main difference would be meeting you actually.
Very kind of you.
Because I think you are the person who showed me the way forward. Basically what I did was, main thing was I was submitting audio consultations. So this time I submitted full 13 video consultations. So I think that would be the game changer here.
Okay, so basically moving from remote audio to face-to-face consultations, showcasing, I suppose, those interpersonal skills as well, really. I think I've certainly stressed that actually you can get so much further in the consultation when you're actually seeing the patient, both in terms of examination and clinical management. On the course, we kind of talked a lot about, I suppose, case priming, finding an angle to your case. How did you encompass this with your new submissions?
So in terms of the previous ones, I had a structure. I think it was not that practical in terms of RCA, but the one you advised, like starting with the first minute, then case priming, then opening agenda, that flow I thought would be more rational and practical in terms of recording. So I think it's very important.
So actually knowing where you are in terms of the patient's narrative, making sure that you've actually looked at the notes before they walk in through the door, opening up their ice earlier on rather than later on, so that we can actually stay close to their ice, readdress their ice. Now, you know, unfortunately, there have been hundreds of people who failed the September, November sitting. There'll be a lot of STs who are quite disheartened, a lot of international medical graduates who are very disheartened. What words of hope and advice can you give these guys who are now preparing for 2023?
Thank you very much for giving me the opportunity. So I got 6 points actually to tell.
Fast, that's great.
The first one is take it very seriously, especially the IMGs, because as you correctly said, I had a very experienced background. I passed MRCGP and 4 diplomas and an MD in first attempt.
Wow.
And all had the consultation section. So I thought this would be a very, very easy one for me. So in the first attempt, I only recorded 13 consultations to complete the target. So just take it very seriously. The second thing is to take your time. Don't rush it. I think in IMG, I think it would be good to record at least for 6 months, because we will get the best towards the end of the time, like for 4th, 5th, 6 months live. And then the third thing is if you submit, there would be 4 weeks gap between the submission and the results. So I would suggest to keep recording during that period as well.
That's a really good tip, actually,
because I mean, if you failed, then you have enough time to get lots of cases. In the meantime, you don't have any pressure during that period, so you just do it as a kind of a hobby. And the fourth one is to follow your protocol and the pathway what you advise. I think that's the main thing. And the fifth one, as you correctly highlighted, to submit videos, because my phone consultations and videos, during my phone consultations, I had low marking for my interpersonal skills, but for the video, my marks are very, very high. So I didn't do anything additional, like talking, my way of interacting with the patient, same, just by submitting video consultations.
You can showcase so much more. I mean, you can say so much over video and face-to-face without saying anything at all. You know, eye contact, body language. Absolutely. Nalin, it's been an absolute pleasure to see you again. I'm so happy for you. What is the plan? Obviously, CCT is coming up quite soon for you. What are you going to be doing?
I'm going to split my time between consultant and GP 50-50.
Good. we can't lose you completely back to gum. You've got to speed it up a little bit. Oh, brilliant. Okay, well, look, please stay in touch. Have a great Christmas.
Thank you very much.
Best for 2023.
Thank you very much for your help and everything. Okay, take care.
Okay, take care. Thank you so much. So huge congrats to Nalin, so well deserved, and just goes to show what a different exam the MRCGP is compared to the MRCP. The difference between a narrative-based exam, which is the RCA, as opposed to one that is simply diagnostic-driven, such as the MRCP. So really important, take-home messages. Make sure that actually we know where we are with our patients in terms of case priming. This is a narrative, so don't try and just be chasing the symptom or the diagnosis. Understand what's happened to that patient before you bring them in through the door. Remember, your cases have to showcase not just clinical challenge, but an angle, and the angle of the case always rests with the complicating factors of the case. So we start thinking about the complicating factors when the patient's ICE doesn't necessarily align with our own agendas. If there is a deeper psychosocial situation which needs to be managed, we talk about the concept of the second golden minute to really help with time management on MentorMRCGP, using the notes, case priming, and making sure that actually the patient's agenda is addressed by the end of the 12 minutes that we have with them. But you also have to showcase risk management. You need to be thinking about the most likely differential so you can base a specific management plan around that. And what Nalin really highlighted actually is the modality of the consultation. You will showcase better for sure when you are videoing, that is to say face-to-face or as a compromise remote video. So thank you so much for listening to this little interview here with Nalin. I hope to do another one with a very successful RCA candidate shortly. Again, think about your case selection, think about how you're going to showcase this, and of course, do feel free to join us on MentorMRCGP, Facebook, YouTube, and hopefully see some of you guys on the course also so we can optimize your RCA case success. Well, all the best. Have a great Christmas, and we'll catch up very soon. Take care.